Hi everyone, my name is Kimberly Balsamo. I am an MPH Community Health Education student with the Colorado School of Public Health, and my presentation is on the public health preparedness and response for the Puerto Rico earthquakes in 2019 and 2020. So between December 29th, 2019, 28th, 2019, and February 4th, 2020, there were approximately 2,500 earthquakes in southern Puerto Rico. And some of those earthquakes were actually aftershocks that had a similar magnitude to the actual earthquakes. Over a dozen of these quakes were of a magnitude of 4.5 or greater. And then the worst of the tremors both actually happened on January 7th, 2020. And the main quake had a magnitude of 6.4 and the aftershock was 5.8. These major quakes killed at least 3 people and damaged tens of thousands of houses and other infrastructures, including schools, bridges, etc. Over 4,000 people, 4,000 people were in shelters after these quakes. And then as of January 9th, 2020, approximately 1 million people were still without power and clean water. On January 7th, the Secretary of the U.S. Department of Health and Human Services, his name was Alex Azar. He declared a public health emergency in Puerto Rico. The largest of the tremors, these earthquakes were the largest of the tremors in Puerto Rico over the last century, and it devastated an island that was already fragile and still working to rebuild after the Hurricane Maria that happened in 2017. Recovery from those earthquakes is likely going to take years as they're still recovering from Hurricane Maria. So some of these local key players were local colleges and universities, such as the University of Puerto Rico, local hospitals, clinics, and medical personnel, health promotion coalitions, such as this Voices, which was a vaccination coalition. And they had this huge emphasis on a whole community involvement with the idea that disaster recovery is most effective when it's locally executed, state managed, and federally supported. The key players from the state or the Commonwealth of Puerto Rico were the Department of Public Health, the Hospital Association, the Medical Reserve Corps, Primary Care Association. Each of these assessed the capacity of medical staff and the centers around, as well as worked to mitigate any of the shortfalls and help to ensure that medical care was accessible to all in need of it. The Puerto Rico Emergency Preparedness Association, or PREPA, they worked on efforts to restore power on the island. The Puerto Rico Emergency Management and Disaster Administration Bureau, they did initial facilitation of shelters and feeding stations, as well as preparing the resources that people used to locate these shelters and feeding stations. The Puerto Rico National Guard, they worked on infrastructure assessment, security and reconnaissance operations, and then evacuation support. The Puerto Rico Civil Air Patrol, or CAP, they did aerial photography to assess the damage. So they did actually missions where they would fly around and assess for structural and land damage due to these earthquakes. And then the Puerto Rico Administration of Mental Health and Anti-Addiction Services, they hosted this crisis hotline to help with mental health locally. Some of the national key players, so President Trump approved emergency declaration on January 7th, 2020. The HHS, or U.S. Department of Health and Human Services, as well as the CDC, so the Secretary of HHS, Alex Azar, he declared public health emergency in Puerto Rico, which actually ensured availability of healthcare and ensured that it would meet the needs of Medicare, Medicaid, and CHIP recipients. And then the Health and Human Services Assistant Secretary of Preparedness and Response, or ASPR, there were liaisons working with local decisions and actions from local officials. And CDC staff were actually on the ground in Puerto Rico as well, coordinating with the locals to assess health conditions of people in Puerto Rico. FEMA also addressed the needs of many of the Puerto Rican municipalities. They had a lot of personnel partnering with local officials. They delivered food, water, and other commodities to the impacted survivors. They established structural assessment and power restoration task forces. And then they also had headed urban search and rescue and then incident support base engaging in the operations. So the U.S. Army Corps of Engineers had two teams working on power restoration, a temporary emergency power team to mobilize equipment as needed, and a prime power team to assess locations for installation of generators. The U.S. Department of Energy worked on increasing power generation to help stabilize the island's already fragile power grid. And then NOAA and the U.S. Geological Survey, they were responsible for preparing the communities and government for the continued tremors and by providing scientific information, forecasts, and broadcasting information over various formats in various languages. The FDA was responsible for assessing the stockpile of critical medical supplies, and then the EPA, Environmental Protection Agency, they helped assess the water infrastructure as well as establish temporary debris management centers. Some of the key players from private sector and NGOs were the American Red Cross, Salvation Army, World Central Kitchen, Send Relief, and Puerto Rico Rises. Those organizations in particular helped in the establishment and facilitation of 19 fixed and 5 mobile feeding stations throughout Puerto Rico. Disaster Distress Hotline was a crisis service hotline for mental health services. Direct Relief helped in general coordination of efforts and supplies for the island. And then Airbnb, they actually offered a program called Open Homes Programs, which allowed the Airbnb hosts to offer no-cost accommodations outside of the impact area for survivors and first responders up until January 31st, 2020. Some of the incident command system roles. So there was a unified command between FEMA and the Puerto Rico government through the Puerto Rico Emergency Management and Disaster Administration Bureau, or PREMDAB. FEMA also was very intertwined with the communications within and between organizations. They coordinated with local officials. They facilitated press releases, and then they were also part of operations staff, using these task forces to assess conditions. And then also an operations staff was CAP. They did the air photography to assess damages to the island. The FDA was involved in planning to keep track of the supply and availability of the critical medical products. And then logistics, logistics had staff from American Red Cross and Salvation Army, just to name a few. They supported the emergency shelters and food and water stations. So some of the strengths of the public health response in terms of ESF, or Emergency Support Function number 8, were in initial and continuous assessments by various organizations in order to determine immediate needs of the population and communities. These assessments actually helped to determine what the priorities were, which were emergency medical assistance, restoration of power, and then clean water. Other strengths were the emergency declaration. It actually provided not only federal assistance to the efforts, but it also provided waivers for certain Medicare, Medicaid, and CHIP requirements. It encouraged or ensured equal access to emergency services. It ensured that the supply of critical medical products would be monitored by the FDA. And then it also required that information messaging would be carried out through multiple platforms in multiple languages and formats. So they were in Spanish, English, American Sign Language, large type font, etc., through various modalities. Then some of the weaknesses. So the Emergency Command Center wasn't activated in a timely manner. It wasn't actually activated until the day after the largest quake hit, which wasn't following protocol. They could have done a lot more if it had been activated sooner. The mental health services were fairly weak. There was a common complaint that mental health was a big crisis from the Puerto Rico earthquakes because they had not yet recovered from Hurricane Maria. And unlike an event such as Hurricane Maria, where there's a definitive end to the actual disaster itself, these earthquakes continued with aftershocks for months to come. So there was a lot of built up anxiety and not a lot of proper handling of mental health for that population. As well as many of the emergency and long-term shelters that were assembled were put in areas that were likely to be affected by weather, making them unhygienic or unsafe to the people staying there. And then there was a general lack of cultural awareness. Although there was lots of housing options available, temporary housing options available to the people, one common thing was people not wanting to leave their neighborhoods, so they would stay in those unsafe conditions, regardless of the potential threat. Some of the strengths of the community's preparedness and resilience were that the FEMA representatives were actually extremely pleased by the Puerto Rico government's proactive nature in providing initial resources and support prior to FEMA's involvement. And then they already had partnerships in place due to the recent nature of Hurricane Maria. So that actually helped a lot with having things to do and being somewhat prepared for this disaster and prepared in the future. Some of the weaknesses for the preparedness and resilience were that while there was a new proposal for a Joint Operational Catastrophic Incidents Plan of Puerto Rico, or JOCIP, it had been proposed, but it was not yet reviewed or implemented. So they really needed to get on that a lot sooner, but it was, it was hard to tell when it would be needed. By the time of the major event, so January 7th, this plan had not yet been implemented, so it wasn't a whole lot of help. They were still able to somewhat follow the ICS, or incident command structure, but they would have had more strategic operations planned had this proposal been implemented and put through the ringer. There was also outrage over the video of a stockpile warehouse that was put together in a response to Hurricane Maria. This warehouse was found still fully stocked, and it caused a lot of government mistrust. A lot of materials that could have been used in this previous disaster hadn't been used, and they found it. So luckily they were able to use it during the response and recovery from these earthquakes, but it could have been very beneficial to have been used during Hurricane Maria. So lots of government distrust there. The Puerto Rico Director of Emergency Management was actually fired because of this situation itself. Another weakness was that while going through the assessments, they noticed that a lot of infrastructure was not quite built to code. And then, as noticed from the response and recovery from Hurricane Maria, waiting for federal assistance could take a very long time. So it was very difficult to respond in a timely manner. Some of the changes that may have occurred following the response to these earthquakes are maybe actually hiring more trustworthy and experienced government officials or emergency management leaders. Also approving an emergency response and preparedness plan ahead of time so that Puerto Rico will be more prepared for any potential future disasters. And then having a greater response focus on providing quality mental health services to an already fragile community, something such as a mental health disaster response plan. And here are my references. Thank you for watching my presentation.